to the American Heart Association, about 375,000 Americans in the United States experience an out-of-hospital cardiac arrest, meaning that most cardiac arrests happen outside the hospital, so like at home or in public. Listening to the speech will help you learn more about how to do basic first aid, because I believe as Americans and as people, we need to be prepared for any situation, whether it's saving someone's life or just helping them out in any way possible. Also, according to the American Heart Association, about 70% of Americans feel helpless during a cardiac emergency, whether it is they don't know how to do CPR, or they know how to do CPR or they're not confident in it, or they know how to do CPR but they're not doing it correctly. So in this speech, I will demonstrate how to do CPR, and this speech is split up into three main ideas. First, I'm going to talk about how to set up the area and the person for CPR. Second, I'm going to demonstrate how to actually do CPR. And then third, I'm going to demonstrate how to use an automated external defibrillator, also known as an AED. So the first thing we're going to do is, if you see a person, or first I'm going to demonstrate how to set up the area for CPR and the person. So if you see a person fall down, and you're going to automatically go up to them, ask if they're okay, but you want to make sure that they're in a safe environment. So you want to bring them to anywhere safe, make sure there's nothing touching them, and make sure that if there's anything touching or close by, you need to move it out of the way, just in case they start having a seizure. You don't want them to hit their head or have any more injuries than they already have right now. And also, they need to be in a supine position, meaning that they're flat on their back. And then you're gonna tap them on the shoulder and ask if they're okay. So, excuse me, sir, are you okay? And if they answer, and you need to be close to their mouth to hear their answer, you have to get consent from them to call 911. And if they're unconscious and they don't respond, you have to check their pulse and then check their airway. So you're going to check their pulse for about 10 seconds to see if they have a pulse or if they have a weak or thready pulse. So I'm checking their pulse. So they have no pulse, so I'm going to check their airway. So when you check your airway, you need to tilt their chin with 2 fingers up and then open their mouth. So tilt the chin up, open the mouth, and you're going to look inside their throat to see if anything's blocking their airway. So if something's blocking their airway, it means there's no oxygen going into the body, so their heart isn't getting the oxygen it needs to pump efficiently. So if something is lodged in their airway, you can either administer the Heimlich maneuver really fast if someone's nearby, or if you have a glove, you put it on and then you open their mouth and just pull it out as fast as you can. Now that I'm done talking about how to set up the area and the person for CPR, I'm going to demonstrate how to actually do CPR. So according to Paula Hopper, she's a nurse practitioner, the best thing to do for CPR when you administer the chest compressions is to interlace your hands together and use the heel of your hand, because it's the hardest part of your hand. And you're gonna place it straight on the chest and the ratio for giving chest compressions is 30-2. So you give 30 chest compressions and 2 rescue breaths. So for chest compressions, you hit hard and fast, and you might feel some bones breaking, but it's totally fine. It's rather you break their bones than unless you lose a leg. So we're giving 30 chest compressions, and it's true what they say when you give chest compressions to listen or hum the song "Staying Alive" by the Bee Gees, if you guys have seen The Office. It's the basic rhythm of the heart, so that's why people recommend using that song. So after giving the 30 chest compressions, you're going to tilt their chin up, and make sure when you give the rescue breaths that you completely put your mouth over theirs. So 2 rescue breaths. And when you give the rescue breaths, you need to look at their chest to make sure that it's rising and falling, because if it isn't rising and falling, they aren't getting the air to their chest, and you got to check to see if there's anything else blocking their airway. So again, we're going to continue to compress, and we're going to do this for 5 cycles, and we're going to try to give at least 100 compressions per minute. And while you're doing chest compressions, the only time you can stop doing CPR and the 2 rescue breaths is when the area is not safe, if you need someone else to help you, and if the AED is ready, and if another authorized person comes and helps you out, is the only time you can stop doing CPR. So while you're continuing to do CPR, someone else can bring the AED. So with the AED, what it is, it's an automated external defibrillator. So it's basically a machine that helps shock the heart while you're continuing to do chest compressions. So if you have another person with you, they'll be doing chest compressions while the other person sets up the AED. So with the AED, it comes with 2 pads. So we're gonna put the 2 pads on the person. One pad goes under the left nipple, and then the other pad goes above the right nipple. And these 2 pads help receive shock waves to the body so the heart starts beating again. So while she's finished doing chest compressions, I'm gonna press a button that says analyzing heart rhythm on the AED. And it talks to you, so it gives you like instructions on what to do. So I press the button, it goes analyzing AED. And then it says no shock needed, so she's gonna continue giving CPR for another cycle. And after that cycle is done, I'm gonna press the button again and it'll say analyzing heart rhythm. And then it says shock needed. So I'm gonna say clear, and then we're gonna back up, and then it's gonna give the shock. And then after the shock, it says all clear, continue CPR. So we're gonna continue giving chest compressions. So we're gonna continue giving the chest compressions and using the AED until the authorized personnel come and take the patient or someone else to the hospital. So this is only a temporary thing. Also with the AED, you need to make sure that you have another person with you because you can't do chest compressions in the AED by itself. So in this speech, I demonstrated how to do CPR. It was split up into 3 main ideas. First, I talked about how to set up the area and the person for CPR. Second, I demonstrated how to perform CPR. And third, I talked about how to use an automated external defibrillator, also known as an AED. And as I mentioned previously, 375,000 Americans in the United States have experienced an out-of-hospital cardiac arrest. And according to the American Red Cross, 4 out of 5 people experience that cardiac arrest at home. So I hope you learned something about this demonstration, that you could possibly be in a situation like this and it can help you in the future. So.